Hi guys, welcome back to my channel. So today I'm going to be talking to you guys about my septoplasty experience. It was a bit of a wild ride, but I want to go ahead and share it with you guys. What I had done was a septoplasty for my deviated septum. I've had that for a long time, and I've always just been a mouth breather, so some of you guys could probably relate. And it was a little frustrating because, you know, I was dealing with that. We ended up moving into a new place, and that place had a mold issue. So because of that, it made it 10 times worse. So once it got really, really bad, as in I was on antibiotics at least 3 rounds within a year, and it wasn't getting better. I just had really chronic sinusitis, had a lot of frontal pain. They showed on the scans that I believe it was my left side. The frontal sinus was blocked, so you could see like gray. So my ENT was like, yeah, like, you know, we can go ahead and, you know, get that looked at, fix that up, but it is going to be another procedure. So what I had done was a deviated septum fixture, which is a septoplasty. So I had a septoplasty, and I had an explorative to see here my frontal sinuses, but to do that they had to go through my ethmoid, and my ethmoid, we had to do the ethmoidectomy. Try saying that 5 times fast. And which is what he described as a honeycomb. So right here, and you go through it, kind of crush it a little bit to get to that and wind it out, clear it out, and you're good to go. On top of that, I also had a bilateral sinus cleansing here on each side, and that was because on top of the headaches, on top of the sinusitis and the breathing issues, I was having pressure on this eye. So what would happen is I would get a lot of pressure, and it felt like my eye was being pushed out. And when I saw him, this was probably like the 3rd time I saw him, because I was going quite frequently, and I was like, hey, is this normal? He said sometimes that does occur, and it's when the sinus isn't like you know, getting everything out properly, and I had already had the issue due to the mold issue in the place we were living at. So when that got really, really bad, and I just kept being on antibiotics and nothing would help, I had bad reactions to some antibiotics, it was just really a big hassle. I got scared, and you know, I told him, I'm like, honestly at this point it's like I'm getting freaked out, like my eye is getting pushed out. And it's scary because, you know, when you feel your eye, it wasn't bulging, but I could feel it. And I asked him, I was like, is that something, or is that just like, am I tripping about it? He's like, no, that does happen. It's usually like, you know, the sinus like is near the eye, it could occur. And you know, I was just weighing pros and cons. I was very scared, all the way up to the night before, even like literally guys, to the moment that I was being like taken in there. And I had a hemorrhoidectomy before, and I was more scared of this procedure than I was for that procedure. And I think it's mostly because it's in your face, you know, it's on your face, and it's very close to eyes. It's very, you know, close over here, and you know, everything's a risk, even with the best ENTs. And my ENT was incredible, top of the board, everything, like awesome. But even still, your girl gets scared. After all that, then I just kind of, you know, waited out. I spoke to one of my friends who's a doctor, and she was like, honestly, like, you gotta get this done, Ale. Like, it's not normal to like mouth breathe forever. And I was like, yeah, I know, it would be nice. Like, there's times where, you know, I would meditate and stuff, and it was really hard because I would get like, I couldn't catch my breath. I was just like, okay, these people are going way too fast, like, you know, breathe in through your nose, and I'm like and I would like struggle, like when I would breathe in, this would collapse and go in. And another thing as well, I forgot to mention, they also had to do a turbinate reduction. So usually they'll do the septoplasty with a turbinate reduction, because it kind of grows a little more to compensate for, you know, the way that it's slightly askew. So in my case, I'll show you guys a picture. It would look like that a lot of the time. And if it would look like the other one where I had a little sliver, I would be happy because I was getting in some oxygen. And yeah, my friend who's a doctor, she saw those and she's like, no, 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 no. you need to get this done. Like, you'll live a better quality of life. Like, I know it's scary, but you know, he's a good doctor, and you know, you owe this to yourself in order to try to live a better life. So I was just scared, like I said, because I was having so many issues, and you know, the eye pressure was hurt, you know, the eye kind of bulging out was scaring me, the frontal headaches and pressure was scaring me, the constant sinusitis was scaring me, and it was, you know, the turbinate always like fluxing and like, you know, just not being able to breathe properly was scaring me. But I ended up going through with it, and let me just say up front, like, it was worth it. Okay, I am extremely grateful. I'm still healing. Like, it's still a little swollen over here. My tip is still a little gentle, like what is it, sensitive. And I'm still like expelling stuff that's been in there. I'm entering my 3rd week. I'm entering my 2nd week post-op, and I'm doing a lot better than I thought I was going to, because the first few days were rough, and you guys will see like in the footage, because I was vlogging it. First day, obviously, I took Norco that first day, but I just hate how it makes me feel. What did help was I can never say it, the extra strength. This is PM, but I'm just showing you because that one literally I had only a few left, and that actually helped out a lot. This one, well, the extra strength, so that actually helped me out. And I would one thing I would suggest that you guys do if you guys are getting this procedure is I would recommend that you guys take notes. So on your mobile, I sound like an old person, on your phone, or you could jot it down like a piece of paper, but I will show you guys here. I literally annotated all when I was taking the medications, what I was feeling. So that one I said, say one more Tylenol, ouch, because I wasn't feeling good. So I was annotating everything. On top of that, you have to take amoxicillin. So I was very diligent on that, and please be very diligent on that. I don't want you to get an infection because that will just make it worse, and all of this is all cut open and you're very sensitive. So please take the amoxicillin or the antibiotic they prescribe you, and just, you know, keep yourself hydrated, because that helped out a lot too. Like, I was just thirsty, and I will say it is horrible. Like you feel pressure like this. It just feels like you have a constant like headache right here. Like, it just does not go away. And then this was all sensitive, and obviously I understand due to the nature of the procedure why, but it was so annoying. Like, I was like, ah, so I couldn't tell if it was like headache from something else or headache from that. I was bleeding a good amount. I will also give you guys some tips on things that I purchased. I bought this one from Amazon, and it is these pads. So they're like cushion gauze packs. They come sealed up, so they're clean. And the tape that I purchased, I don't know, I don't know, I'm not gonna recommend this one if you have sensitive skin, because I ended up like I would change it a few times a day because it would just bleed through, and it would hurt my skin so bad. I ended up being raw over here. I'll put a picture of how it was, and even like taking it off gently, it was a bit of a struggle. Find another brand or a super extra gentle, and this is a gentle one, so I would find much more gentler ones if you have sensitive skin as well. I also use Neosporin, and I would recommend that as well, just regular Neosporin. I didn't use the one with the this original formula. There's one that has like pain like medication onto it. I didn't get that, and I would put this on a Q-tip, and I would just put it in here. And also I would use it on my lips, and I know it sounds really bleh, but I would use it on my lips because I'm like, just in case I don't want to get any germies there, I'm like moving and touching. And at night it helps because you have to sleep with your mouth open. Yep, it's very uncomfortable. I felt like, oh my god, without exaggeration, my tongue felt like sandpaper, like, because you have to breathe. So I would just wake up, and you know, Andrew would be like, here, drink some water. I drink some water, and I had water next to me with a straw. I would also recommend that, like a tall one from Starbucks. And I would just drink from there and drink, and I drank so much water just because it was like everything's, you know. But I would also recommend, you know, you get yourself some tissue, some puffs or something gentle, but just for light dabs, nothing crazy, because you should change it. Once it was like day 2 and 3, I was progressing on to using this. This is baby wipes. They're for boogers for little kids. I saw someone else actually recommend this, so I'll leave her video down below. And I also purchased this one. So this is the mist spray. And I wanted to show you guys the difference between the Simply Saline with this is the Arm & Hammer brand. You could just purchase this one to put it in your nose and introduce, you know, saline and keep it clean and moist, versus the baby one. So the baby one, I'll show you like how fine the mist is. You guys see, it's really really fine. And then this one, it's fine too, but you see, I feel like the baby one was a lot more gentle on my nose, and especially since it's still healing, I would strongly recommend this one, and I'll leave this one down below as well. Other than that, I also got one of these from the hospital when I left. So it was just kind of like, you know, to have that if I need it or if I need to spit. I will say that all of this in conjunction did help me out, obviously, because I wasn't as freaked out because I was like prepping myself. So I would recommend watching other videos, some other folks' experiences, and I think that should help you become a little more calm and relaxed, and hopefully your procedure goes well and, you know, you're able to breathe a lot better. I will say for me, in my case, like as soon as they took out there's packing in there. So what they put is a packing, but in my case this one dissolves. So the packing dissolves and it ends up being like goo. So it comes out like goo, like a big snot. It was really gross, but you can feel it in there. It's really, you just feel like super congested is the best way I can feel. Like super congested, super compacted, super like tender, you know, pressure, and your eyes water all the time. My eyes were watering all the time because it kind of just feels like, you know, like you're like, I didn't get the urge to sneeze until like day 4 or 5, thank God, because when I sneezed, it was like a snot with blood, and I was like, that's it, this is how I go. It hurt, but it wasn't, I just ended up learning how to sneeze with my mouth open, and it's really gross. So it's not attractive, but it does prevent pain up there if you really need to sneeze. Oftentimes I'd be able to like hold it back, but if not, you gotta do what you gotta do. I would say right now I can breathe so much better. Like as soon as they cleaned it up on day 5, yeah, because my ENT was unavailable, so his assistant had to do it, and then I saw him like a week after. So I got this removed. I got they cleaned out the thing that was in there that was goop, so they cleaned that out, and I have a video for that as well. I'll show you guys. So they cleaned that out. They put some numbing spray first, and then they went ahead and they cleaned that out, and I could breathe a lot better. They did leave the splints in there, and I was like, oh my God, because you can feel them, and that's what causes a lot of the pain. At least in my case, it caused a lot of the pain because you could just feel it. And they removed that. It was the 7th day they removed it. And once they removed it, I have the video for that too, and that one's a little graphic, but you know, it felt a lot better once it was out. Oh dear baby Jesus. That wasn't that bad. I mean, it sucks.
Yeah, it sucks, but yeah.
Yeah. Okay, let's come in.
I understand what you're saying, yeah. I mean, back in the good old days, we used to put way more aggressive packing in there.
My left side, I still have a little bit of congestion up here, but it's nothing as it was before, and I'm still cleansing everything out using the Neti-Pot that I have. I also purchased the one where you just like squeeze it with your hand and it comes out this way. It's a lot more messy for me, but I do prefer the other one. It's called the Naväge, because that one you just hold it, you press it, and it does it for you. And I really, really have been enjoying using that one. It's just a lot more easy. It is a pretty penny, but I think it's worth it. And I think that if you're getting this procedure, we should be more attentive to kind of keeping it clear and clean, so that way we can, you know, kind of avoid any infections down the road. So far I've been feeling good. My forehead over here feels fine. I don't feel the pressure here anymore as well. Like I said, I do have a little bit of congestion here, and then sometimes I feel the boogies and I'm like, you know, I'll spit them out, like I have to like go like and then spit it out. But way better than before. And breathing is crazy, guys. Like when I even had the splints in there, I was still like, I could smell things, but it was delayed. So if Andrew was cooking something or my parents brought something, I couldn't smell it like this, like here. It's really weird. I couldn't smell here, but I could smell it when it got up here. It's really weird, I know, but it was bizarre. Like I was like, okay. I didn't get any of the tooth or gum pain. Some folks had that. I was expecting that. I didn't get that, thankfully. I could still taste stuff, and the smell, it was like weird. It was there, but it was delayed. That's the best way I can describe it. I haven't seen anyone, you know, share that they've had that, but in my case, it was delayed. So if there was like something, if there was like cheese or something here, right? And I can't smell it off the bat when I go, but I can smell it once it gets up here. Very weird. So, you know, that was my case. But in terms of breathing normally, like I'm fine. And I also like visited my cardiologist after. They did an echogram just to check everything. And that was just because they were still checking my heart before the procedure to make sure, like, are you okay? Are you not? And I was okay from that. But then after the surgery, I still had to do the echogram in my case. And they checked my heart. They said it was fine. It wasn't enlarged. And that, again, that's not standard for this procedure. It was for my case. They noticed as well as like my breathing wasn't as, because my heart rate would always be really, really high, right? But ever since I had the procedure and I could breathe a lot better, it's been like in the 60s, 70s, and usually it would always teeter like 80s, 90s, just me existing, you know? So I'd like to think that it was because of that, because it's a lot easier to breathe. Like, I could never have done that before. Like get a full breath in without getting jagged, like, because it would collapse. I'd be like that, and I'd be like, because I couldn't get any air. But I was unable to do that, and like that makes me so happy, because I'm really glad that I took the chance, you know. And I was really fearful, like I said, but you know, it's made my life, I don't know, it's weird, it's made breathing enjoyable. I know that sounds weird, but it has. And I hope that if you're gonna go through this procedure, that it goes well for you as well. I know there have been a lot of folks who are nervous and stuff about empty nose syndrome, because I did a lot of research on that. I went down the rabbit hole. I'm telling you, I was doing too much research, but honestly, it's good as well. In my case, like I was very grateful, and he was very smart, because when we were in the like pre-op room, he gave me some Afrin. So it's a spray, and it kind of like, you know, makes your turbinates a little like constricts them. And he's very smart for that, because he made them constrict before the surgery, so he wouldn't remove so much when they're normal, if that makes sense. So if they're already big, you know, and they're not constricted, then it's like you can remove like a good amount. Like what if, you know, it's like too much, and then you end up with empty nose syndrome. But no, he put the Afrin. He made me put the Afrin. He's like, all right, I'll see you over there, you know, blah, blah, blah. And then he did the surgery. So my turbinates, which are the little hot dog ones, they were constricted a little bit. So I think that's really smart. I think that was just one extra thing that I was like, okay, cool. Like, he really cares about me. So, and he was trying to do the surgery like as best as he could. And I think he did a really good job. Even if this is still a little congested, I'm still grateful, because being conservative is like 85% better, right? But it's a world of difference, and I feel very excited. I feel like I'm going to be able to work out a lot better. Because usually, you know, I'd breathe in through my mouth. I'm like, so it's like I couldn't catch my breath, and I'm really excited for that. I will also say a few more things. You're not supposed to lift or do anything heavy for 4 to 5 weeks, so I still have some time there where I gotta chill for a little bit, which sucks. But you know, walking and moving about has been a lot easier, so I'm taking the wins there. Also, when you're sleeping, you have to sleep sitting up. at least for the first few days, because you don't want to put any pressure like while you're down or anything. I just slept up. I also recommend like a travel pillow. Sorry, this one's all dirty. A travel pillow, and this one as well was like memory foam. So I tried switching it up to see it, like which one would be best or more, you know, the one that didn't bug me the most. This one was okay, but it was good if you were like sleeping like that on the side or you're watching TV and whatnot. But these kinds were better because it's a lot thicker here. So I would just be like that and then lean on the couch. I slept on the couch for the bulk of the days or the nights, excuse me, and Andrew would come and check up on me and stuff. Because he was just like, I couldn't, like, I was just like there and, you know, move. But yeah, so I wanted to add that as well, so you guys are able to get a good night's sleep. I'm not gonna lie, I didn't sleep that much, like, comfortably, between the, you know, sandpaper situation and like just waking up with the pain. There's times where, you know, my mom had told me, she's like, don't let the pain catch up to you. And a nurse told me that too. She's like, you know, you have it logged. Like, if it's about to approach like the 4th hour, like, you know, maybe take the pain medication there, because then it's going to start hurting. And I didn't heed that. And man, oh man, was I in pain sometimes. Obviously, you know, like, take precautions for your particular case. But in my case, I was like, man, like, I let myself get caught up sometimes and it hurts so bad. So with all that being said, thank you so much for watching the video. If you have any other questions, please be sure to leave them down below and I will get back to you as soon as I can. I hope you or whoever is watching this, or whoever you're going to care for, or if it's someone you know, I hope their procedure goes well and they could breathe a lot better.